And do you give consent for us to record?
Yes.
Okay. So today we're here for a well visit, and you also are having headaches as well?
Yes.
Okay. And then when was the start of the headaches?
Started about 2 months ago.
Okay. And then is there a certain spot where you feel the headaches most?
Yes, on the sides of my temple.
Okay. How long do they typically last, have you noticed?
Usually a few hours.
Okay. Okay. How would you describe the feeling of the headaches?
Like a throbbing, like pounding.
Okay. Does anything make them worse?
Light, actually, and loud noises.
Okay. Okay. Has anything made them better?
I've been using like cold compresses and in the dark room and sleep, Excedrin too.
Okay. Okay. Have you noticed a certain time where they occur more frequently?
When the weather's like a little gloomy or when I'm under a lot of stress.
Okay. And then if you had to rate the headaches at their worst, how would you rate them 0 to 10?
Oh, 10 out of 10.
Okay. All right. And then what about with the Excedrin? Does that make it any better, or how would you rate it with that?
It goes to about a 6.
Okay. Alrighty. And then I know I briefly viewed your history. I know that you have the hypothyroidism and the hypertension. You had a cholecystectomy in 2019, and you're still taking the hydrochlorothiazide and Synthroid, right?
Yes.
Okay. And then we know you're doing the Excedrin as needed, and there's no drug allergies. And then, so we're just going to go over some symptoms. I just want to make sure you're having no other symptoms as well. Systemically, you haven't had any fevers, fatigue, chills, sweats, any appetite changes?
No.
Or any weight changes that you've had concerns about?
No.
Okay. As for your skin, have you had noticed any rashes or color changes or wounds?
No.
Okay. Ears, nose, throat, any congestion, dental problems, ear discharge, ear pain, mouth sores, sore throat, anything like that? Okay.
No.
As for your neck, any neck pain, stiffness, or masses?
No.
Okay, good. As for your breast, any discharge, lumps, pain, or tenderness?
No.
Okay. And then for your lungs, any chest tightness, cough, shortness of breath, wheezing, choking?
No.
And then any chest pain, palpitations, or any leg swelling that you've noticed?
Thank God, no.
Okay. And then any abdominal pain or distension, diarrhea, nausea, vomiting?
The headaches do give me nausea.
Okay, all right. Does that seem to go away once the headaches are gone?
Yeah.
Okay. And then any changes in your skin texture or skin color or in the temperature of your skin?
No.
Okay. Any difficulty urinating, pain with urination, frequency, blood in the urine?
No.
Okay. Have you noticed any hot flashes, postmenopausal bleeding, pain with intercourse, any vaginal discharge or vaginal odor?
No.
Okay. Any body aches, joint pain?
No.
Okay. I know you have the headaches neurologically. Any dizziness though, or lightheadedness, numbness, tremors?
No.
Okay. And then any, have you noticed that you've had any bruising or bleeding that happens easily?
No.
Okay. Any cold or heat intolerance?
No.
Good. And then any agitation, confusion, hallucinations, or anxiety?
No.
Okay. And then I'm just going to briefly go over your preventative screenings. I know that I see your last mammogram was a month ago, and that looks good. You're 55, so you're not due for your osteoporosis screening at this time.
Yeah.
Your last pap smear was 3 years ago, and that's good. They're doing it every 5 years now, so not due. And your last colonoscopy was last year, and that was normal, which is good. Do you have any questions?
No, that's all.
All right, sounds good. And we'll see you at your next visit.
Thanks.